Hi, Courtney from Back to You Physical Therapy, here to talk to you about a little bit you can do if you have plantar fasciitis. Plantar fasciitis is an inflammation of the plantar fascia, which is the soft tissue or fascia in the bottom of your foot. It can cause pain with first step in the morning. It can be uncomfortable if you're standing or walking. And I just want to show you a few things that might be beneficial to you if you have plantar fasciitis.
A fun stretch you might want to do before getting out of bed is pulling your foot up, flexing it, grabbing your toe, and then pulling that up as well. Feeling a nice stretch right through the plantar fascia. This is something you can hold for 5 to 10 seconds, and you can do, let's say, also 5 to 10 of them. It can just help kind of loosen up the area so that when you're taking that first step out of bed, it's not as painful. Another way to loosen up your foot and ankle is get yourself a nice grip on your toes with your hand and just kind of twist back and forth. You're just getting some good mobility out of your forefoot there, kind of rocking the fascia and the bones back and forth a little bit. Since I'm sitting cross-legged anyway, I'm going to show you another one of my favorite exercises to strengthen the posterior tibialis, which runs through the arch of the foot and provides a little arch support. Sometimes people who don't have enough support with this muscle through the arch of their foot will put more strain through the plantar fascia. So what we're going to do is we're going to get our foot fully pointed like a ballerina, and we're going to lift it up and down, up and down. The trick with this is as you're lifting, you want to keep the foot as pointed as possible. You don't want to come up and do it in this angle. As you can see, it is a little bit difficult to control. It's a little shaky for me. So that might mean that I need to do more of this exercise myself. It's not uncommon to feel cramping through the arch of the foot when you're doing this. So, take it gentle, be careful. This is something you might want to do 20 to 30 reps of, or you might want to come all the way up and do a nice little hold there at the top for maybe 5 to 10 seconds and then relax.
This next one is going to be for the deep intrinsic muscles in your foot. I'm going to try to keep this bone right here in contact with the floor, and all I'm going to do is just scrunch the towel and relax. Scrunch the towel and relax. This is something you want to do maybe 20 to 30 reps of. Sometimes in the clinic I'll have people pick up marbles with their toes as well, but if you don't have a ton of toe dexterity, scrunching the towel is a lot easier. Last but not least, I'm going to show you some calf raises as well. Sometimes the plantar fascia will get stressed if the calf isn't strong enough. So something you can do is calf raises. You can do calf raises on 1 foot, or 2 foot is easier. You want to make sure that you're bearing weight evenly through the 2 balls of your feet, so not coming too far up to the inside or outside. You want to go nice and slow all the way up and all the way down. And you can do holds at the top. You can even do these off of the stairs if you want, letting the heel drop down and going through a larger range of motion. As you're doing these, you want to make sure that you are not gripping through the toes as you're doing the calf raises at all. Keep those toes nice and relaxed, lifting the heel up and down.